Plantar fasciitis, a concise factual ebook. Introduction. Plantar fasciitis causes pain in the bottom of the heel. The plantar fascia is a thick, web-like ligament that connects your heel to the front of your foot. It supports the arch of your foot and helps you walk. Plantar fasciitis is one of the most common orthopedic complaints. Your plantar fascia ligaments experience a lot of wear and tear in your daily life. Normally, these ligaments act as shock absorbers, supporting the arch of the foot. Too much pressure on your feet can damage or tear the ligaments. The plantar fascia becomes inflamed, and the inflammation causes heel pain and stiffness. The major complaint of those with plantar fasciitis is pain on the bottom of the heel, but some people experience pain at the bottom mid-foot area. This develops gradually over time. It usually affects just one foot, but it can affect both feet. Some people describe the pain as dull, while others experience a sharp pain. Some people feel a burning or ache on the bottom of the foot extending outward from the heel. The pain is usually worse in the morning when you take your first steps out of bed, or if you've been sitting or lying down for a while. Climbing stairs can be very difficult due to heel stiffness. After prolonged activity, the pain can flare up due to increased inflammation. Pain isn't usually felt during the activity, but rather just after stopping. You're at a greater risk of developing plantar fasciitis if you're overweight or obese. This is due to the increased pressure on your plantar fascia ligaments, especially if you have sudden weight gain. Women who are pregnant often experience bouts of plantar fasciitis, particularly during late pregnancy. Your doctor will perform a physical exam to check for tenderness in your foot and the exact location of the pain to make sure that it's not the result of different foot problem. Your doctor may ask you to flex your foot while they push on the plantar fascia to see if the pain gets worse as you flex and better as you point your toe. They'll also note if you have mild redness or swelling. Your doctor will evaluate the strength of your muscles and the health of your nerves by checking your reflexes, muscle tone, sense of touch and sight, coordination, balance. An X-ray or MRI scan may be necessary to check that nothing else is causing your heel pain, such as a bone fracture. Causes. Under normal circumstances, your plantar fascia acts like a shock-absorbing bowstring, supporting the arch in your foot. If tension and stress on that bowstring becomes too great, small tears can arise in the fascia. Repetitive stretching and tearing can cause the fascia to become irritated or inflamed, though in many cases of plantar fasciitis, the cause isn't clear. If you're a long-distance runner, you may be more likely to develop plantar fascia problems. You're also at risk if you have a very active job that involves being on your feet often, such as working in a factory or being a restaurant server. Active men and women between the ages of 40 and 70 are at the highest risk of developing plantar fasciitis. It's also slightly more common in women than men. If you have structural foot problems such as very high arches or very flat feet, you may develop plantar fasciitis. Tight Achilles tendons, which are the tendons attaching your calf muscles to your heels, may also result in plantar fascia pain. Simply wearing shoes with soft soles and poor arch support can also result in plantar fasciitis. Plantar fasciitis isn't typically the result of heel spurs. A heel spur is a hook of bone that can form on the heel bone, or calcaneus, of the foot. According to the American Association of Orthopedic Surgeons, AAOS, 1 in 10 people has a heel spur, but only 1 in 20 people with heel spurs experiences pain. Risk factors. Though plantar fasciitis can arise without an obvious cause, factors that can increase your risk of developing plantar fasciitis include age. Plantar fasciitis is most common between the ages of 40 and 60. Certain types of exercise, activities that place a lot of stress on your heel and attached tissue, such as long-distance running, ballistic jumping activities, ballet dancing, and aerobic dance, can contribute to an earlier onset of plantar fasciitis. Foot mechanics. Being flat-footed, having a high arch, or even having an abnormal pattern of walking can affect the way weight is distributed when you're standing and putting added stress on the plantar fascia. Obesity. Excess pounds can put stress on your plantar fascia. Occupations that keep you on your feet. Factory workers, teachers, and others who spend most of their work hours walking or standing on hard surfaces can damage their plantar fascia. Complications. Ignoring plantar fasciitis may result in chronic heel pain that hinders your regular activities. Changing the way you walk to minimize plantar fasciitis pain might lead to foot, knee, hip, or back problems. What are the treatment options for plantar fasciitis? Reducing inflammation in the plantar fascia ligament is an important part of treatment, but this doesn't address the underlying damage to the ligament. Home treatments. Initial home treatment includes staying off your feet and applying ice for 15 to 20 minutes, 3 or 4 times per day to reduce swelling. You can also try reducing or changing your exercise activities, using arch supports in your shoes, and doing stretching exercises may also help to relieve pain. Non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen, Motrin or Advil, and naproxen, Aleve, often reduce inflammation in the ligament. Medical treatments. If home treatments and over-the-counter anti-inflammatory drugs don't ease the pain, an injection of a corticosteroid directly into the damaged section of the ligament can help. Your doctor can do this in their office. Your doctor may use an ultrasound device to help determine the best place for the injection. Your doctor can also apply corticosteroids to the skin of your heel or the arch of your foot, and then apply a painless electrical current to let the steroid pass through your skin and into the muscle. Physical therapy is an important part of treatment for plantar fasciitis. It can help stretch your plantar fascia and Achilles tendons. A physical therapist can also show you exercises to strengthen your lower leg muscles, helping to stabilize your walk and lessen the workload on your plantar fascia. If pain continues and other methods aren't working, your doctor may recommend extracorporeal shockwave therapy. In this therapy, sound waves bombard your heel to stimulate healing with the ligament. Side effects of this treatment can include bruises, swelling, pain, numbness. Extracorporeal shockwave therapy hasn't been proved to be consistently effective in relieving symptoms. Surgery is the most dramatic therapy. This is done only in cases in which pain is severe. Your surgeon can partially detach the plantar fascia from the heel bone, but this weakens the arch of the foot and full function may be lost. Another surgery involves lengthening the calf muscle. This process is called gastrocnemius recession. Braces and support. Night splints are another treatment that can help stretch your calf and the arch of your foot. Night splints are a type of brace that holds your foot in a flexed position and lengthens the plantar fascia and Achilles tendon overnight. This can prevent morning pain and stiffness. Special orthotics or arch supports for your shoes may help alleviate some of the pain by distributing pressure, and they can prevent further damage to the plantar fascia. A boot cast may immobilize your foot and reduce strain while the plantar fascia heals. You can remove the boot cast, which looks like a ski boot, for bathing. Plantar fasciitis socks as an aid to relieve the condition. Plantar fasciitis can be an incredibly painful condition to live with on a day-to-day basis, let alone while trying to incorporate running into your routine. Athletes can find this condition to be especially debilitating, since it can not only make it difficult to establish an effective exercise plan, but also because the pain can be aggravated by repetition and strain. Special plantar fasciitis socks can reduce impact and further prevent pain. An option to consider when choosing the best socks to maximize your running potential. Compression is only one treatment option for plantar fasciitis, but the socks are convenient and an easily accessible option. To fight plantar fasciitis, you will want a sock with a lot of support for the arch and other areas like the ankle and ball of your foot. Plantar fasciitis socks benefits include fast pain relief from plantar fasciitis pain, ankle sprains, and arch strains. Walk freely again by getting instant relief arch support and increased circulation to stop throbbing heel pain. Targeted ankle compression allows you to move freely without restricting motion. Ankle recovery from graduated compression and heel support provides relief from Achilles tendonitis and a boost in blood circulation, thereby reducing swelling and hastening the plantar fasciitis healing process. Versatile design allows it to be used for plantar fasciitis, Achilles tendonitis, ankle sprains, twists, heel spurs, swelling, stress fractures, splint issues, and inflammation. Foot sleeves are preferred by professional trainers and physical therapists for its gradual compression, durability, and lightweight, breathable fabric, providing instant pain relief for long-term use. Foot sleeves are built tough so that you can wear them all day and night. It is comfortable and fashionable, as it won't stop you from your normal daily life. You feel the comfort and softness as the compression socks maintain joint stability and posture. The open-toe design allows you to wear them with anything: shoes, sandals, slippers, boot with insoles, and under any socks. With the anti-odor, moisture-wicking, and breathable fabric, you stay dry and protected throughout your gym workouts, hiking, cycling, running, office work, and other sports and activities. Flexibility in a sleeve. Socks are suitable for men, women, child, and youth. Wear all day and night for stability and mobility through therapeutic healing effects. Comfort from compression foot sleeves provide all-day relief, limiting plantar fasciitis, foot, and heel aches. The compression ankle support reduces edema in your feet, relieving Achilles tendinitis and splint pain by compressing the plantar fascia ligament. Phenomenal value. Don't settle for less when it comes to your health. Not satisfied? Just return for full refund risk-free. Great gift for women or men, family, friends, teachers, nurses, athletes, airplane travelers, or anyone getting their life back on track by reducing pain and increasing mobility. No need for fake copper-infused claims. Gel heel pads as an aid to relieve plantar fasciitis. As we walk, the heel of the foot strikes the ground, causing shock waves to travel up through the heel and ankle and into the leg. These forces can lead to heel, knee, hip, and back pain. By cushioning the heel and diffusing shock on heel strikes, we can prevent these conditions from occurring. The heel area provides the foot with the first point of contact, and this requires physical protection that is contained between the skin and the heel bone. However, this area is frequently injured during sporting and other high-impact activities such as carrying heavy loads. The gel cup's elastic molecular memory means that it regains its shape after heavy loading and naturally protects the heel from impact injury, and 30-day guarantee. These heel cups for plantar fasciitis support the ankle and heel while reducing pain, inflammation, and foot fatigue. They evenly distribute pressure across the back of the foot to alleviate stress on the muscles and ligaments. The cups are hand washable and fit into most shoe styles. Pros: made of antimicrobial and latex-free materials, massaging and shock absorbing, 60-day unconditional guarantee. Cons: socks may stick to the gel material when putting on tight-fitting shoes.